Dr. Joanne Lobo, a pediatric infectious disease specialist here in Davao Doctors Hospital. In celebration of the Breastfeeding Month this August, I will be discussing in today's MedTalk series the breastfeeding advocacy amidst the COVID-19 pandemic and the role and use of our COVID-19 vaccines for our pregnant and lactating mothers.
Let me start by reading the PPS policy statement on breastfeeding. Exclusive breastfeeding is ideal during the first 6 months of life, and after this period, complementary foods as well as continued breastfeeding is recommended for at least 1 year and preferably beyond. This is supported by the Baby Friendly Hospital Initiative, the Republic Act 7600, also known as the Rooming In and Breastfeeding Act of 1992, and the Mother Baby Friendly Hospital accreditation by the DOH. In this time of pandemic, the DOH, WHO, and UNICEF jointly appealed to the public to protect and support the practice of exclusive breastfeeding of infants from birth to 6 months and continued with complementary feeding onwards with breastfeeding. Several guidelines and memos have been released since last year, just like the July 13, 2020 DOH Memo 0319 entitled Interim Guidelines on COVID-19 Management of Pregnant Women, Women About to Give Birth, and Newborns, that contact suspect, probable, or confirmed COVID-19 mothers to consider breastfeeding or use of express breast milk to their newborns as an informed choice or a shared decision. A year after that, in July 17, 2021, the Centers for Disease Control in the U.S. released several statements. First, breast milk is best source of nutrition for most infants. Second, people without suspected or confirmed COVID-19 and who have not been in close contact with someone who has COVID-19 or have been fully vaccinated for COVID-19 do not need to take special precautions when feeding at breast or expressing milk. Third, breastfeeding person considered a suspect or confirmed or contact of COVID-19 case should follow guidelines on isolation or quarantine, observe precautions while feeding at the breast, expressing milk, or feeding from a bottle. And lastly, current evidence suggests that breast milk is not a likely source of SARS-CoV-2 infection. Thus, breastfeeding is still best for babies for them to be protected from illnesses because antibodies in breast milk combat diseases, and they have found out that breastfed babies have shown less severe respiratory symptoms. Second, breastfeeding is also good for mothers because hormones released during breastfeeding relieve stress and anxiety, and that breast milk is always readily available, especially in public health crises, just like during pandemics. Now, can we vaccinate pregnant women with COVID-19 vaccines? Here are the facts about the effects of COVID-19 on pregnant women and their babies. In early pregnancy, the virus is not associated with increased chance of miscarriage, and that vertical transmission where the virus passes from the mother to the baby in the womb is relatively rare. Babies of COVID-19 mothers seldom get sick, and that COVID-19 infected pregnant mothers have higher risk of preterm birth, have higher risk of severe illness, and have increased risk of adverse pregnancy outcomes. Now, in the U.S., a clinical trial on messenger RNA vaccines in Massachusetts focused on 84 pregnant women, 31 breastfeeding, and 16 not breastfeeding. They found out that antibody response is greater than that of natural infection, that antibodies to COVID-19 in mothers have been passed on to the placenta and breast milk, and that 2 doses of vaccine to pregnant mothers gave the highest antibody level in the cord blood. Now, with the above findings, the following guidelines were released. DOH Interim Guidelines on Vaccine Deployment February 23, 2021 stated that women belonging to Priority A1 of workers in frontline health facilities who are in their first trimester of pregnancy may be vaccinated after the first trimester. The WHO in February 2021 recommends that benefits versus the risk assessment be done. The information about the risk of COVID-19 in pregnancy, the likely benefits of vaccination in the local epidemiological context, and the current limitations of safety data in pregnant women should be presented to them to help them make a decision. And lastly, the CDC also in June 2021 stated that pregnant women can receive a COVID-19 vaccine as a personal choice, considering the benefits of vaccination and the risks of severe COVID-19 illness. Okay, the last we have to discuss now is, can we vaccinate breastfeeding mothers? No studies to date have been done on lactating mothers. And the recent report said that lactating mothers with mRNA COVID-19 vaccines have antibodies in their breast milk which could help protect their babies. DOH in their memo dated February 23, 2021 stated that breastfeeding women may be vaccinated with COVID-19 vaccine. PPS on March 21, 2021 made a statement that all COVID-19 vaccines may be offered to breastfeeding women after consultation with their physicians. And in the same month, CDC also released a statement that based on how COVID-19 vaccines work in the body, COVID-19 vaccines are not a risk to lactating women. And the WHO in Chief Scientist Dr. Swaminathan clearly advised that COVID-19 vaccination to breastfeeding women and that vaccines are safe with no risk of multiplying in the body and that antibodies can be transmitted in the breast milk. So my take-home messages for today are as follows. Breastfeeding should continue even during the pandemic. Confirmed COVID-19 mothers are encouraged to continue breastfeeding and that COVID-19 vaccines may be given to both pregnant women, especially those who are in the A1 category, and that vaccination for pregnant women should be given after the first trimester. And of course, COVID-19 vaccines may be given to lactating mothers. Thank you all for listening.